If you are above 50 years old, avoid consuming these 12 items. Today, we'll look at 12 foods that are damaging to the health of those over the age of 50. Certain changes may occur in your body as you become older. Organ functioning gradually decline as we age. You feel ill or suffer from diseases due to a variety of environmental factors. Bone and joint disorders, diabetes, high blood pressure, cardiovascular disease, and cognitive loss all occur as we become older. You will also notice that the body takes a long time to repair and recover from injuries, and that previous injuries reappear. This is a warning sign. You need to take better care of yourself. To dramatically enhance your quality of life and ability to regain vitality, you must change poor behaviors and adopt more healthy ones, such as eating and exercising. Furthermore, it can significantly lower the risk of age-related disorders like cardiovascular disease, diabetes, obesity, and osteoarthritis. So, what exactly does a healthy diet look like for people over the age of 50? How can you determine which foods are truly damaging to your health and avoid incorporating them in your daily diet? Don't worry, we'll provide you detailed instructions below. Let's look at 12 meals that should be limited for persons over the age of 50. We'll also provide you practical information on how to protect your health after 50. Discover why these foods should be avoided and how they harm your overall health. First, we'll discuss the negative effects of eating grapefruit after the age of 50. Grapefruit is naturally healthy to the body since it includes a lot of fiber, as well as more than 15 vitamins and minerals, including vitamin C, A, potassium, thiamine, folate, and magnesium. Grapefruit also includes several potent antioxidant plant components with numerous health advantages. For typical individuals, eating grapefruit can help avoid constipation, promotes optimal calcium and iron absorption. Grapefruit, in particular, contains a high concentration of natural folic acid, making it very beneficial for pregnant women. Eating grapefruit also helps you lose weight, lowers harmful cholesterol and triglycerides, and efficiently lowers blood sugar. However, this is for the old. More specifically, older folks use exceedingly harmful medicines because eating grapefruit has the potential to alter the effects of certain drugs. Grapefruit should be avoided, especially by people with heart failure. The basic reason is that grapefruit might raise medication levels too high in the bloodstream. This is extremely risky for patients since it produces a similar effect to medication poisoning. When the body has high levels of fat in the blood, taking grapefruit juice or eating grapefruit near a meal containing weight reduction medication might cause muscle soreness and potentially renal illness. If you are on anti-allergy medicine and eat grapefruit, it can trigger headaches, heart palpitations, arrhythmia, and, in severe circumstances, death. Furthermore, do not consume grapefruit after drinking alcohol or smoking since the pyranocoumarin in grapefruit stimulates the metabolism of intestinal enzymes, cytochromes P450. This increases the toxicity of cigarettes and alcohol, as the poisons are absorbed into the body faster than usual, especially nicotine and alcohol. Furthermore, you should avoid eating grapefruit with crab because it can easily induce stomach irritation, resulting in pain and vomiting. As a result, if you are taking medicine and using grapefruit, see your doctor beforehand. The next category is alcoholic beverage is next on the list. Increased cancer risk. Many studies show that older alcoholics are more likely to get cancer than non-drinkers, including mouth cancer, nasopharyngeal cancer, esophageal cancer, and esophageal cancer, breast cancer, colon cancer, and liver cancer. The body will convert alcohol to ethanol. This chemical is broken down in the liver, producing acetaldehyde. Acetaldehyde causes DNA damage in cells, increasing the likelihood of cancer development. When drinking heavily, resistance weakens, particularly in the elderly, and the disease worsens faster and is more difficult to treat. Drinking alcohol also increases the risk of liver failure, which can develop in the elderly who consume it on a regular basis. Long-term use will cause the liver to become fatty. Some of them will develop cirrhosis or hepatitis, resulting in many fatalities. Drinking alcohol can also lead to pneumonia in persons over the age of 50. Alcohol lowers your immune system and raises your risk of lung illness as you age. Skin and hair issues. As we age, our hair and skin grow drier and more unattractive. Elderly persons who use alcohol over an extended period of time frequently lose water from their bodies, including their skin. Dry skin, fragile hair, breakage, pale skin, and vitamin shortage are just a few of the immediate and long-term consequences of this. Heart disease and hypertension are more common among the elderly. Alcohol is a direct poison to the heart muscle, which exacerbates this illness in the elderly. It can result in the loss of the heart muscle or the formation of fibrous tissue to replace the heart muscle cells that cannot contract. It causes leg edema, irregular heartbeat, shortness of breath, weariness, and ultimately, heart failure. Arteriosclerosis raises pressure in the arteries and veins, hence drinking alcohol raises the risk of high blood pressure. Alcohol can also induce vasoconstrictive hormones. High blood pressure is a major risk factor for both stroke and heart failure. Kidney disease. Drinking alcohol excessively can increase the risk of kidney disease, particularly in the elderly. Pancreatitis. The pancreas is an endocrine and exocrine gland that secretes digestive enzymes into the small intestine to aid in food processing. However, alcohol reduces the production of digestive juices into the pancreas. Digestive enzymes and alcohol metabolism produce acetaldehyde, which induces pancreatic inflammation. Acute or chronic pancreatitis can result in diabetes and mortality. Osteoporosis. Alcohol makes bones more weak and thin. When determining a person's risk of bone fracture, doctors must consider alcohol as one of several crucial factors. Malnutrition, which can cause weak bones and fractures, can also develop in those who consume alcohol. The next category is dairy-containing products. Older persons may have difficulties digesting milk or dairy products. Dairy products include a high concentration of saturated fatty acids, which is one of the causes of cardiovascular disease, hypertension, and diabetes. However, the elderly may not need to avoid all dairy products because they are an important source of calcium and protein for the body. Plain fat-free yogurt and low-fat cheese are particularly beneficial options for the elderly. The fifth ingredient on the list is caffeine. If you are over 50 and drink too much caffeine, it will stimulate your heart activity. Caffeine can make you anxious or restless, elevate your heart rate, and make it harder to sleep. Caffeine-containing beverages raise the risk of sleeplessness and cardiovascular disease, particularly in persons over the age of 50. Caffeine users who are elderly should gradually discontinue their consumption, as abrupt discontinuation might produce headaches, nausea, or vomiting. Previous research suggests that those over the age of 50 should limit their consumption to 4 cups per day. According to a recent study, the daily caffeine intake should be between 200 and 400 milliliters to avoid long-term harmful consequences. Drinking more over 600 milliliters per day, which is comparable to 7 cups of coffee, will result in unpredictable results. Elderly individuals who drink coffee should follow these guidelines. Drink less, don't drink too strong, don't drink for too long, and don't drink before bed. Sugar is not to be missed. Limiting sugar in foods and beverages in the elderly's nutritional regimen will help minimize the risk of cardiovascular disease, diabetes, hypertension. Eating a lot of sugar in the elderly puts a strain on the body because the body absorbs too much sugar but does not use it all, so it is turned into stored fat, increasing the risk of cardiovascular disease, overweight and obesity, and blood pressure. High amounts can lead to more serious consequences like strokes and dementia. Consider substituting sugary products and snacks with healthy and nutritious options. Grilled dishes rank 7th on the list. The elderly's immunological and digestive systems frequently deteriorate as they get older. As a result, eating too many grilled foods puts a strain on the digestive system. At the same time, dishes grilled directly over fire can easily emit poisons that are hazardous to the body, including cancer-causing pollutants. The next category is instant foods. Instant foods, such as potato chips, instant noodles, and quick porridge, as well as fast foods like hamburgers and fried chicken, have very few nutrients and are high in oil. Fat increases the risk of digestive tract disorders such as diabetes. 9th is animal organs. Animal organs include a high protein content, thus consuming them on a daily basis can cause a variety of problems in the elderly, including hypertension, gout, blood fat, and heart disease. Circuit. The 10th is food with a high salt content. People above the age of 50, as well as those at high risk, should limit their sodium intake. The recommended salt intake for persons over the age of 50 is 2,300 milligrams per day. For persons in the high-risk group, avoid taking more than 1,500 milligrams of salt per day. A high-salt diet raises blood pressure, which increases the risk of cardiovascular disease and stroke. 12th, carbonated beverages. Carbonated beverages are detrimental to the health of the elderly. These drinks are low in nutrition and contain a lot of ingredients that are bad for your health. The organ's functions deteriorate as we age. As a result, a diet to protect the health of the elderly is critically important. Hopefully, the information offered in this article will help readers learn more about foods to avoid in the elderly. If you find this video useful, show your interest by pressing the like button and subscribing to our channel. This will help you stay updated on future health tips. Enjoy your day, and we look forward to seeing you in the next video.